Now, if we still don't do something about it, if we're still going, okay, I'm still going to stay up in fight or flight mode, by the way I'm thinking about things, then we start to notice these strains start turning into pains. So let's go through some of these. These are more obvious. What are some of the... So you said, what's your name? Lexi. So tell me again. So this, what you said, goes here. What you said you have? So chest pain. Popping. And then what else? Was that mostly it?
Pretty much. I kind of like, it starts in one spot, and then if it gets really bad, it will kind of like cramp.
It's like what?
It feels like a cramp in my
A cramp. Okay, this is interesting. Hold on one sec. Or is it related to that? Oh, go ahead then.
I have the same thing, and I used to think it was like heart attack.
It feels like that painful.
That's like what?
Okay. Now, I want to explore something that is a little bit down the road, but since both of you mentioned this, I've really been studying this a lot lately. And, you know, if you look at if you were a health scientist, somebody who was studying health as a profession somehow, and somebody said, okay, I need to know the main risk factors for heart disease, what would you probably say? The commonly held risk factors for heart disease. What are the ones that we know of? Because heart disease is number one for the most common chronic disease, correct? So what are the things that tend to lead toward that? What? Okay, sitting around too much. Smoking, for sure.
I was gonna say lack of activity.
Okay, yeah. What else?
Well, they say high cholesterol.
Yeah, unfortunately, that's not as big a deal as it used to be, thank goodness. What else do we know of?
Diet.
For sure, what we eat. If it's a high sugar diet, high bad fat diet, helps out. What?
How much stress they're carrying.
Okay, so hold on to that part, because they don't, and until recently, they wouldn't acknowledge that stress was a piece of that. Yeah, if you've got buildup of plaque in the blood vessels, it increases the likelihood. And what tends to lead to atherosclerosis? Because of, yeah, primarily because of high blood pressure, right? And smoking. The nicotine creates high blood pressure. If you're a guy, your chances is higher. The older you get, the chances are higher. So I saw one study where they took into account all the kind of risk factors that lead to heart disease, and they could only account for about 50% of all of the heart disease that's out there. 50%. So the question is, what's the other 50% that's leading to the lots of heart disease? Say it. It's because of stress. It really is. And if we analyze a heart attack, it's really, really interesting. And we're not going to spend too much time in here on this, but it's almost the same. When the fight or flight response is on, it's almost the same as nicotine. What you said with smoke, it's almost exactly the same action. Heart rate goes up, blood pressure goes up, blood sugar goes up, blood vessels narrow, and if you've got a blood vessel that's highly atherosclerotic and it's narrower, what are you setting yourself up for if one of those blood vessels is on the heart.
Stopping blood flow to the heart.
Yeah, everything downstream from where that is suddenly clogged dies. And it's the exact same, it's everything about the stress response in the long term is directly related to heart disease and cardiovascular disease and heart attacks. So what I'm guessing with you two is the heart is just beating harder than normal. Now, have you had your blood pressure tested? Do you know how your blood pressure is? Is it normal? Do you know? Well, I'm not saying for sure. When you tested your heart rate the other day, do you remember what it was? Do you remember? Do you remember what the number was?
What's like normal? I just remember that it was it was 30.
So you counted 30?
Yes.
So your heart rate's 60 then,
Yeah.
right?
Yeah.
Do you remember yours?
I think my heart rate is 58.
Yeah, so that's low. There's nothing wrong with it doesn't sound like there's anything wrong with your hearts. When you're in the stress response, however, you have irregular activity of the heart and blood vessels, and maybe that's what's showing up as the pain that feels strange. And it might be other things, but now the other thing that I can think of is when you're in the fight or flight response, you got muscles contracting all over the place. You got these muscles are contracting, these muscles are contracting. You're breathing with muscles that aren't designed to help breathe. They call them intercostals. You should only breathing naturally is just using the diaphragm. As it comes down, air goes in, your stomach moves out. We'll get into this when we get into the relaxation, one of the relaxation exercises. But if you're breathing irregularly, if you're tightening up, any number of things could happen. Okay, what else? What other pains? Let's continue with other things.
Just random muscle pains, arms, legs,
Muscle pain.
muscle cramps.
So cramps too, not just pain, but
Twitches.
I got to tell you, hold on one second. Did I tell you about the lady who we taught how to meditate?
Yeah.
Where she was sitting and moving her leg all the time? Did I tell you about her? Yeah. That's kind of those twitches only at the whole leg level, but you feel things happen on your body where it's just going zzz, and you touch it and it's like, wow, that is really strange that it was going. Or have you ever been falling asleep at night and you find yourself going like this, or your leg starts twitching and stuff? It's just your body's going, okay, finally she's lying down. I'm going to now try and deal with this stress, release it somehow, the energy of it, through the twitching or the jerking or whatever. It's just, there's nothing wrong with that at all. Now, we talked about, if we went back to Josh's example, if you do that long enough, you're going to have pain. Easy. Okay, you said you wanted to say another pain? Headaches. Okay. Now, how many in here get migraines? Do we have a few who get migraines? Are migraines and stress, does stress lead to migraines? But not always. There might be other reasons for migraines. The other kinds of, does anyone in here get cluster headaches?
Used to.
Do you know?
I used to take pills and now I stopped taking pain pills for them because
They created the cluster headaches?
like I literally.
Did you say you get, so what does a cluster headache feel like?
So a lot of pain, a lot of behind my eyes and back here, and it kind of moves around.
Do you notice that there's a stress piece to it?
A little bit. Mine because I have like a really bad neck. So whenever like my neck hurts, it goes up in my head.
So if you go to a chiropractor, if you ever go to one, does after you've been worked on with him or her, does it feel better?
Yeah.
Yeah, okay. So it's a structural thing in your case. Good. I had a friend who I'll tell you about later on, but he told me he got cluster headaches, and he said it's like a migraine times 10. I can't imagine how painful that must be. I have no concept of that level of pain. He wanted to shoot himself every day because it was just so painful. So cluster headaches and migraines may not always be stress-related. There might be other variables, like structurally, as you were saying, good example. Stress headaches, pressure tension headaches, in my experience, 95% of the time, that is stress-related. I remember this last weekend, I was talking to a guy who's a physical therapist, and I asked him, because he deals a lot with pain, I said, what do you do for people with headaches? He said, oh, headaches are easy. And in my book, they are easy as well. He explained to me, and this is the same explanation I give to, I mean, he's got it right on. This is how a headache happens most of the time, a tension headache, is you have muscles that start back here, and they come up, and, you know, it's like these muscles continue up on the top of your head, right? There's also nerves that are firing through here as well. And when those muscles, when they're in a state of tension, in the state of contracting, which is what happens when you're in the fight or flight response, these muscles start contracting. They're sitting on these nerves, and as they contract, they impinge on those nerves. That's what causes the headache. That's what's happening when you have a headache. So what's the solution to that besides take care of the stress? I mean, what's the solution to the symptom of headaches? What? Could be. Whatever it is that will relax those muscles so they're no longer impinging on those nerves that are sitting right parallel to them. He says, yeah, I just massage. That's what he says. I massage these for a little while. He says he knows exactly which muscles to massage. And he says, headaches are easy to fix. And when we get into the relaxation exercise, I say the same thing. Headaches are easy to fix. Because all of these things are symptoms of this problem. Get rid of the problem, symptoms will start going away. These are symptoms. It's kind of like you have, I love this analogy where you have all of these weeds, right? One might be a headache, one might be fibromyalgia, one might be pain in your chest, one might be, they're all symptoms, but they're based on the roots that is stress. If you get rid of one of these weeds, what's most likely to happen? Continuing with that analogy, if you get rid of the weed, this particular flower symptom, what's going to likely happen? Stress is still there, and what do roots do? Grow something else. What we do in America today, around the world, is we're busy dealing with the plants, the flowers. Oh, there's a headache. Let's take care. Oh, there's fibromyalgia. Let's take care of that. Oh, here's heart disease. Let's take care of that. My feeling is if you take care of the stress, all those things may not immediately, but over time, those things, I have no idea. And I'm not saying this because I'm anything different than anybody else. I have no idea what it feels like to have a headache. No idea what it feels like to be depressed. I have no idea what it feels like to have an ulcer. And I'm as normal as anybody. There's absolutely nothing special about me. I don't have good genes. If you could see my genes, you'd go, phew.
Before you started down this
Good luck.
career path, you didn't have any of those symptoms?
No, I did.
Oh, you mean just
now.
Yeah, in the last 30 years, I've been sick maybe 6 times where I couldn't function normally.